Hi, everyone. We're still waiting just for a few more minutes, but we're ready to start pretty soon. All right, I think we're ready to start. So, hi everyone, and welcome to the Johns Hopkins University Virtual GIS Week. You're currently in a session on GIS and spatial analysis in environmental health. We're very glad that y'all were able to make it, and we're very excited for our panelists this afternoon. My name is Anton Kvitt. I'm a senior research data analyst at the Spatial Science for Public Health Center at the Johns Hopkins Bloomberg School of Public Health, and I'll be the moderator for today's panel. First, I'd like to introduce our co-sponsors. So GIS Week is sponsored by the Johns Hopkins Center for a Livable Future, which is an academic research center focused on the intersection of public health, the environment, and food systems, as well as the Johns Hopkins Spatial Science for Public Health Center, which is an academic research center focused on the development and application of spatial analytics, GIS, and spatial statistics, all for public health research. So before I introduce our panelists today, I'd like to go over just a few housekeeping notes. So this session is recorded and it will be made available after all of our sessions are complete. Also, so please post your questions for the speakers in the Q&A box. And then we will have time for only one question for each speaker after their presentation. And then we'll have an open question and answer period at the end of the webinar. All right, so now to introduce the panelists and generally. So today we'll hear from researchers at the Center for Environmental Medicine and Informatics at the State University of New York College of Environmental Science and Forestry. They'll share their research, including applications of spatial analytics. Their work aims to address problems at the intersection of environmental exposure and human health, including projects examining environmental links to cancer, health disparities in morbidity and mortality, and links between environmental stressors and cardiovascular disease risk. Our first speaker is Mary Collins. She's an assistant professor in the Environmental Studies Department. Dr. Collins studies socio-environmental systems, equity and justice in the context of human health, health disparities, and environmental justice. She has particular expertise in computational science, social science methods. Our next speaker is going to be Mike Petroni. He's a PhD candidate in environmental science graduate program of environmental and natural resources policy. Mike studies federal toxic chemical regulation, big data analysis, and risk communication, specializing in emergency planning and community right to know act. While writing his dissertation, Mike supports data quality, enforcement targeting, and pollution prevention efforts as a contractor for the Environmental Protection Agency's Toxics Release Inventory Program. Mike has also supported news outlets with air modeling and population health risk screening for planned industrial development. And finally, we're going to hear from Dustin Hill, who's another PhD candidate in an environmental science graduate program for environmental and natural resources policy. So Dustin completed his Master's of Science in 2017 at SUNY ESF with research focusing on both the sources of industrial pollution as well as the impact on communities and the environment with a focus on environmental inequality. His current research examines human health impacts of exposure to industrial air pollution in Syracuse, New York, and a study of how federal government contracting influences behavior of manufacturers and their decisions to implement additional pollution control technology. So, and now I'm gonna stop sharing my screen and we can give the floor to Dr. Collins.
Can everyone see my screen okay? Hopefully. It's a super pleasure to be here today. You know, I think one of the silver linings of this is getting connected in, you know, through these online mediums to groups like this one. I think that, you know, it's not that we couldn't have gotten together in person, but I'm not sure that we would have. And so it's a super pleasure to be here, and thank you so much for the invitation. So, so what I am going to talk about today is I'm going to give you an overview of the center that I'm the director of, and where Mike and Dustin are fellows and do a lot of the spatial work that we conduct. And then I'll also present a project that is pretty emergent in the context of wastewater monitoring, spatial analytics, and visualization, trying to link some of the microbiology that goes on in terms of identifying COVID-19 or SARS-2 pathogens in wastewater, and trying to communicate with decision makers as we navigate these uncertain times. So as I mentioned, the Center for Environmental Medicine and Informatics, which is at SUNY ESF, we are a group that is interested in collaborative translational research focused at addressing problems in environmental medicine. And so what this means for us is that we are fundamentally interdisciplinary in what we do. So we work across the natural sciences, the social science disciplines. We have really close collaborations from the chemistry department, from microbiology, from public health. And we work across, in Syracuse, we have 3 campuses that are really close to one another. So SUNY ESF, Syracuse University, and Upstate Medical University. And what we're really interested in and what we're linked by is trying to understand the connection between environmental hazards and potential health impacts among human populations. We all have different skill sets, I would say, and we are linked by reliance on informatics, big data approaches, and a reliance on scientific computing to develop new tools and technologies for understanding these types of disease connections. I want to talk just a little bit more about translational research before I get into the wastewater example that I foreshadowed earlier. So translational research is inherently collaborative, and it is a important hallmark of what we do at the center. So some people refer to translational research as bench to bedside, where scientists work across many fields with medical researchers to try and accelerate both the translation of discovery that might happen at the bench and the types of practice either of medical professionals or public health professionals that might happen at the bedside. And these are really looked at as going both directions. And so what we've been really trying to do is to work on projects that have real world significance and be really tightly linked with both our academic counterparts, but as well as our practitioners in the community or you know, bureaucrats in the regulatory system, trying to make direct links, right, between what we learn and you know, reactions that might occur. So the example that I have for you today, and Mike and Dustin are going to talk more about some other projects that are farther along, but one thing that we've been working on, which is really exemplified in the mission of the Center for Environmental Medicine and Informatics, is what we call the SARS-2 Early Warning Wastewater Surveillance Platform. We started this group back in about probably April, May. We went home for spring break right when the pandemic was starting to ramp up in New York. And David Larson, who's an epidemiologist at SU, and Hyatt Green, who's a microbiologist at ESF, really pioneered this group and pulled together people from our center, from ESF more generally, from Upstate Medical University. And we have a wide range of activity of expertise here. So my expertise in this context is spatial modeling or disease modeling. We have David Larson and Brittany Kamush, who are doing epidemiology work, and Brittany is a Johns Hopkins alum. And then we also have people in information systems and microbiology and chemistry trying to come together to figure out how to do this. At this point, we were sort of a group of motivated people to try and, interested in this topic. But throughout this work, we really designed a strategy for quantifying and identifying SARS-2 RNA in wastewater. And where we are right now, and what I'm going to present to you today, is where we are with doing the spatial analytics and the communication back to managers who are making public health decisions really on a daily basis. So a little bit more about wastewater. Some of this might seem familiar to you. So right now, it takes about 5 to 9 days for symptoms of COVID-19 to appear in the healthcare system. So during those 5 to 9 days, anyone who is infected is sort of in a state of pre-symptomatic transmission. And during that state, while they're not exhibiting symptoms that might show up and bring them into the healthcare system for testing, SARS-2 RNA is shed fecally about 24 hours after infection starts. And so our thought was to start identifying potential upstream transmission by conducting systematic wastewater analysis to both identify and quantify SARS-2 RNA as an early warning contribution to the surveillance system for the disease. This is not a new tactic. Those of you who have expertise in this area will know more than me probably, but environmental surveillance has been successful in the context of poliovirus and same type of situation. I mean, different pathogen, of course, but so it's not entirely new, right, to be doing this type of wastewater analysis as a way to identify upstream cases and then help to, have people make decisions about changing testing or changing public health protocol, like ramping up social distancing reminders or something like that. So back in about, I think it was about June, we started contributing to the literature in the context of the microbiology, and the microbiologists were working closely to be able to develop the science for quantifying and identifying SARS-2 RNA in wastewater. And what emerged was this COVID-19 real-time transmission tracking surveillance system. So we have data collection that happens from, we have a bunch of counties that have participated in the project so far across New York State. And we do wastewater treatment, wastewater sampling at wastewater treatment facilities, as well as some upstream pump stations within some counties. From there, we identify and analyze the wastewater sample for SARS-2 RNA, and we quantify the viral load in the catchment. And we have we have made a bunch of efforts to classify geographic areas as having changes in transmission. And we are hopeful that by developing a communication strategy where we classify geographic areas as having changes in transmission, that we will identify trends earlier than one might identify them if you waited for testing to happen in the healthcare system. The last phase is to, aggregate data and relay it to those who will be making decisions and, make it as useful as possible. As I mentioned, we have been working on this project since about April, but and we've made a ton of progress, but I would say where we are right now is somewhere between classifying transmission spatially and then aggregating and relaying it. And so what I'm going to do today is try and present where we are with the spatial side of things. I'm happy to answer other questions about the microbiology as I can, but given the focus of today, I think it makes more sense to talk about where we are with classifying geographic areas. So right now, this is a live SARS-2 wastewater surveillance dashboard that is currently only accessible to those who are participating counties, so mostly county officials. So what we have here, these are just screenshots. I figured it was safer to do screenshots than try and use it real time online here, but Dustin did a lot of the coding for this project. This is an RShiny app. So what we have here is we have 2 New York State maps. We're showing 2-week trends of wastewater sampling at the county level. So we have multiple points within each county that we're sampling. And then we have, we're showing a 2-week trend here because although we have data all the way back, it makes more sense to, really be looking just recently in time. So if the app was live, if you hover over any of these county geographies, you'll see a alert level coefficient in real time. This is just a screenshot, but and it looks pretty white right now because things are pretty flat. So this, I update this. I update this probably 2 or 3 times a week after we get samples in, and so each county geography gets coded as, either trending upward, or if it is more orange, or trending downward if it's more blue. As I mentioned, right now, things are pretty flat because there's been pretty consistent findings lately. And then the map on the right side here, this is a confidence map is what we're calling it. What it really is it's a model fit statistic that just indicates how well the model is fitting the data. And so if you had data points jumping around, you'd have a lower confidence value. If you have data points that are really trending in a specific way over time, then you have a high confidence value. And so this is sort of a high level overview possibly. And then what happens is that after you click on a specific county, so right now I've clicked on Onondaga County, which is where Syracuse University, SUNY ESF, and SUNY Upstate Medical University is located. This is Onondaga County right here. And you can see more about the geometry of the catchments where we're doing the sampling, and you can see some of the changes that are going on within the county. So Onondaga County has a pretty complicated wastewater system, more so than some of the other counties that we're working with. And we have each of the wastewater catchments here, and you can see that some of them are trending down and some of them are trending up. So the more yellow, they're trending up, the more green, the more blue, they're trending down. And then we have the same confidence map over here to the right. I haven't shown all of the interactivity here, but you can click on and click off zip codes and other types of things that the Department of Health was really interested in having. The way that the interactivity works for this map is that if you click on any one of these catchment geometries, you get a detection trend line that'll show what's been going on over time. And so our hope is that a user of this application would come to this application on a very regular basis, see an overall trend at the county level, and then click within the county to see what's going on at the sub-county level. As I mentioned, this is a really early phase in development, and I probably talk to counties, I don't know, I talk to counties every day for sure about, what's going on in their county and if they can get more fine-grained information or help with interpretation. And so we have a few planned developments, sprints that we're going to do sometime in the future, hopefully soon, but things keep everything there. It has been a very busy time. So one of the things that our county executives have been very interested in is pairing the results with public health method messaging. And so what we found is that it would be very helpful, right, to, you know, see a flat line and understand more about, does that mean that we're high, you know, we're high in, you know, high in detection and staying high? Does that mean that we are low in detection and staying low? And what is the public health message that one might consider in the context of this type of finding? Another thing that we have also learned is that we're showing 2-week trend lines for this project, but this is really a view into the future in some ways, because we would expect that if you had a bump up in detection over a 2-week trend line, the cases will show up in the healthcare system, you know, later, you know, a week to 5 to 8 days after, you know, you see the bump in wastewater. And so what would be very helpful to them is to have some interactivity where you could have some sort of 2-week historical trend where you could slide back in time to a time where you maybe knew that there was a strain on the healthcare system and see what the wastewater results were at that point, just to learn more about sort of how these things work. Another thing that we're continuing to innovate is how to present changes over time, especially in the context of, you know, whether or not it's a change from, you know, or whether or not it's a flat line from, you know, high detection to high detection, which would be something to know, or whether or not, you know, some of these are actually very small changes in time that these, you know, vertical line or these 45-degree lines look like it's a huge change, but really it's a small change and it's an artifact of how we've scaled the y-axis. So we continue to do that. And we also continue to learn more about back-end performance and enhancement, because as more county executives get hooked into this tool, we do see some strain on the computational system. So, you know, this is a very early project that is very collaborative and linked directly, right, with both the microbiology that's going on, as well as the public health professionals at the county level. I would also mention that this project has also included some building level wastewater surveillance, but that's not included on the maps because of confidentiality issues associated with being able to identify upstream folks. So that's all I really have for today. As I mentioned, I'm you know, associated with the Center for Environmental Medicine and Informatics at SUNY ESF. My contact information is there. And this work was very generously funded by the SUNY Discovery Challenge program, which started in 2019. And we have recently received funding from the New York State Department of Health. So thank you very much.
Dr. Collins, thank you very much for sharing. Dashboards are something that our center has also been involved in, so they're near and dear to our hearts. So I was just had a question in terms of the display, right? So you're displaying the chloroplasts and stuff. Are there thoughts of introducing spatial statistics in there as well? So whether some kind of cluster detection or other forms?
Absolutely. I mean, I think that like we had a list of sort of what we thought was required to make it minimally viable from the standpoint of just launching it. And so we would love to have a better handle on how to really estimate upstream transmission rather than simply changes in like genome counts at the treatment or catchment level. And right now, you know, I'm really just showing changes in detection. But obviously, what everyone really wants to know is, well, what does that mean for upstream transmission? So cluster algorithms or other types of accounting for potentially like the proportion of homes upstream in the catchment that are on septic versus those that are on sewer. Or, you know, I've also had some other people talk to me about incorporating cell phone data from the standpoint of like how much movement is going on within a specific region. to make some estimate of how we really think transmission is occurring upstream. And one other thing I would mention, and I didn't talk about this that much, is we think that estimating upstream transmission from the standpoint of how prevalent it is really important, but also whether or not there is upstream transmission. So you might have situations where you have very low spikes in SARS-2 from the wastewater perspective, and that might give counties executives information related to potential absence of transmission, and that would help with bolstering or increasing confidence in decisions like small scale openings or whatnot, from the standpoint of having confidence in moving around. So
got it. So I think we're going to move on to Mike. There's plenty of questions, and we'll return to them at the end in our Q&A session.
Hi, everybody.
Mike, there we go.
All right, there we go. That's better. It's nice to speak with everybody today. I'm going to apologize in advance. My internet is a little shaky, so I might cut out for a few seconds. So thank you for your patience. I'm going to share a couple of studies that we've been working on in the last several months that we're pretty excited about, and including some open source resources that we have online that will help anybody reproduce these studies or learn a little bit about spatial analysis and accessing publicly available data. So the first study I want to share with you is an investigation into the role between chronic hazardous air pollution exposure and COVID-19 mortality on a county level in the United States. We recently published a paper here that is available in the Journal of Environmental Research Letters. If anybody wants to go out and read a little bit more about it, it's open access, so I encourage people to take a look if you want more details. So I'm going to briefly go through the steps of this project from data sets that we pulled together for this analysis. Sorry if I cut out there. So we're going to go through data access and synthesis, our statistical approach, and then talk about policy implications, because we did find an association between chronic hazardous air pollutant exposure and increased levels of COVID-19 mortality. So first, we had to acquire our dependent variable, which are death rates at the county level across the United States. And when we initially were drawing data online for this study, we used the Johns Hopkins database, and we also cross-referenced it with the New York Times database and the New York City Department of Health. We wanted to make sure that we had as detailed information as we could, because there were some gaps in the data at the early times in the pandemic when we started this study. For our main independent variables, we drew from EPA and CDC data sources. And the most important part of this were a great data set called the National Air Toxics Assessment. This is a procedure that EPA performs every 3 or 4 years based on the National Emissions Inventory, where they put together a modeling run to estimate at every census tract in the United States levels of 180 different hazardous air pollutants. And then they also produce organ-specific toxicity weighted concentration estimates for all those tracks. So this is a great environmental public health database that can be drawn upon for spatial analysis. We also looked at a couple of criteria air pollutants, particulate matter and ozone that we incorporated into our models. And these came from the CDC Wonder database and EPA's EJ screen. So looking at the relationship between COVID-19 and mortality and pollution doesn't paint the full picture. So we needed to draw on several different potential confounding variables. These include things related to health and healthcare, things like hospital capacity in a county, smoking rates, obesity rates. We also wanted to look at potential proxies for the spread of the disease. And these included things like urban population percentage in a county and how long it's been since the first case was reported. And then we included a full battery of socioeconomic and demographic variables, because as we've seen throughout this pandemic, your background plays a large role in your risk of succumbing to the disease. Most of these data we obtained from the United States Census and from a great database called County Health Rankings and Roadmaps, which includes longitudinal data going back for decades, and it's provided by the Robert Woods Johnson Foundation. We're really excited that we were able to include all of the code for performing this analysis on GitHub, and we did everything in an open source program called R, and anyone can go up there and recreate this analysis from accessing the data online. We have it, you can run through the code, it's got links, and it will draw the data down, it will curate it, it will clean it, and it will run the models and create the charts. So it's a great learning resource as well, as a nice way to update your study when you get feedback from reviewers. So the first thing we did when we heard about the potential had some prior experience working with and related to COVID-19. Sorry if I cut out again there, but so this is the first graph that we created. We just compared hazardous air pollutants to COVID-19. And what we're looking at on the x-axis here is the respiratory hazard index, which is concentrations of hazardous air pollutants that are known to affect the respiratory system, weighted by a toxicity factor called the reference concentration. And you can see this dotted line here, which indicates the EPA's screening level risk limit for concentrations of these compounds. And as we can see here, most counties in the United States are below this limit, but we still can see a general trend. So we wanted to learn more, and so we decided to run some regression models. So the map that we're looking at here, we have the COVID-19 mortality as of April 19th, and you see a lot of the United States didn't have any cases, or not cases, but deaths at this point. So we ran some zero inflated negative binomial mixed models. And these were mixed because they included state fixed effects, because every state has a different policy for social distancing, different healthcare setups. And we also tested for autocorrelation using Moran's eye, but we didn't find any, so we didn't do any adjustment for spatial autocorrelation. So here are our results. I'm not going to go through all of this in detail, but the bottom line here is we saw about a 10% increase or a 9% increase in the mortality rate on average in a county for every 0.1 increase in the respiratory hazard index. So as you remember from before, the index is basically from 0 to 1 is in the safe range, but we found that even at the low levels, we were seeing relatively moderate or high increases in the mortality rates for each county. We also found associations between specific compounds, and these include acetaldehyde and diesel particulate matter. So these counties with high levels of these compounds, ones with a lot of high traffic areas and areas in the southern United States where acetaldehyde is created through secondary formation in the atmosphere, they were highly leveraging on our model. So what does this mean? What does this mean for policy and protecting our population against these kind of the shocks to the healthcare system? And this kind of goes back to our theme of translational science and how can we turn these results into real research that can affect policymaking. So what we kind of take away from this study is we see that where you live in the United States determines a lot about your health, and that this risk is not equally distributed, and it is very much distributed more heavily towards low income and minority populations. This finding where we're seeing effects, health effects at levels below regulatory standards indicate that potentially more precaution would help save lives in the future. And this precaution can be taken through bolstering the efforts at the EPS risk or the integrated risk information system, where they evaluate the these reference concentrations for each of these chemical compounds, and additional precaution and study will lead to hopefully us understanding more about the long-term health effects of exposure to one or more of these chemicals. And the second here is assessing and banning and regulating use of chemicals under the Toxic Substance Control Act, which is ongoing right now. So switching gears, the second study that I want to share with you all is called New York Enviro Screen. This is a tool that we've developed for identifying potential environmental justice areas, also known as disadvantaged communities, in New York State, for the purposes of affecting and implementing certain laws that have recently been passed in New York. So this is a spatial analysis tool that brings together several data sets to create a environmental justice score. So it's going to be used hopefully, or maybe help influence a final tool that is created under the Climate Change or the Climate Leadership and Community Protection Act. So this landmark law is mandating that New York get to 80% renewable energy by a certain date, and 100% then soon after. And it does so by generating renewable energy credits, which generates revenue for the state. And they've earmarked some of that revenue to go to disadvantaged communities throughout the state. The main question is, how do we identify which community is disadvantaged versus which community is not. So New York Enviro Screen pulls together all this data to try to answer that question in an open source and accessible, data-driven manner. It's also going to help update permitting restrictions that have been previously put in place as part of New York's Environmental Justice Act at the Department of Environmental Conservation and through the State Siting Board for energy projects as part of the Power New York Act. Hopefully this also can be an example which other states can use to bring in more sophistication into these tools. So we do this using 3 different steps, and we try to combine a few methods in order to work with the prior policy that was in place and a desire to incorporate additional data factors. So the first part of this is creating a cumulative impact model where we rate each block group in New York State based on these 5 different factors of exposure, hazards related to pollution, and then population characteristics of sensitivity, socioeconomic vulnerability, and health. And using per state percentiles, we combine these groupings to create a cumulative impact score called the New York Enviro Screen score. This framework is adopted from California's Cal Enviro Screen, and it's been heralded as a really useful tool in helping to ensure that environmental justice is realized in California. So we think it's a good tool to adopt our program in New York with, and we incorporated some additional aspects like sea level rise, change, heat island effects to try and address some risks from climate change that are going to face New Yorkers. The second part of this is a clustering process that was implemented back in 2000 as part of New York's first environmental justice policy. And it's a Jenks natural breaks algorithm that splits the distribution of block groups based on 3 different metrics and creates these thresholds that say if you're above this threshold, you're a potential environmental justice area. If you're below, you're not. And so we wanted to update this process using more recent data, but we wanted to also incorporate it into this tool so that we didn't lose the protections for some communities that had been given to them before. Sorry again if I cut out, but this is just a continuation of the CP29, and it's based on the percentage of individuals of a non-white race in either rural or urban block groups, and it's related to the number of individuals living underneath the federal poverty line. And then third, we wanted to incorporate more protections for indigenous communities and tribal areas. So we added a new step to this process where we classify a block group as a disadvantaged community if it intersects or borders a tribal area in New York State. And you can see here in the maps in the 2003 potential environmental justice area classification, there's not as much rural areas as in Part B here, which is our proposed new version. That in the teal there, you can see that some of these block groups were added on as because of their intersection with tribal areas. So then we implement, with these 3 different processes, we implement a decision tree to then classify each block group. And basically it's starting from the top. If you're in the 75th percentile or higher in terms of your cumulative burden score or cumulative impact score, New York Enviro screen score, you are classified as a disadvantaged community. If you're not in that, you can still become a disadvantaged community if you are over the poverty or minority thresholds, or if, on the last line here, if you're intersecting a tribal area. This new method creates a more robust coverage in New York State that allows for these funds to be distributed to areas that they may need to go, and provide protections for more communities in New York against the permitting of new polluters or large electric generating stations. And we believe that it's a more data-driven and robust way to go about it. So if you're interested in learning more about this project, we have a article preprint out at this link. And we also have the code for doing this entire analysis, as well as creating a Shiny app viewer that shows this data interactively. And it's all online and following these links. And I thank you guys for your attention and your patience. Sorry for cutting out a few times there, but I'd be happy to hear any questions.
Hi, Mike. Both very interesting studies. Thank you for sharing. One question I had regarding the COVID study. So, different countries had responded to COVID with various success. And also at the same time, there's quite a variability in terms of environmental protections and stuff like that. Are there plans or ideas about, comparing the results from the model that you had to other countries with perhaps more robust healthcare systems, or systems that have responded more effectively, to see how much of this environmental effect might have been negated by the healthcare response, for example?
Well, we haven't had any plans to do that, but I think that is definitely a good question. And I have seen some recent research related to particulate matter that compared several countries against each other. And but I would expect that a more robust healthcare response or lockdown procedures, it would certainly negate some of the magnitudes, but we would hypothesize that even though the magnitude or air quality would see more cases. Sorry, I cut out again, but we'd be interested to see that, to look at that in the future.
Gotcha. Yeah, and then like you said, we can ask further questions later on. So we can move to Dustin. And by the way, Dr. Collins has been great at answering the questions that other attendees have sent in our Q&A. So feel free to keep sending those questions.
Let me get my presentation ready. All right. Okay, thank you all for coming to our presentations today. I'm going to be presenting results of a study looking at spatial exposure to air pollution among children sampled in Syracuse, New York, and how we can link that potential exposure to clinical data. So for this project, our colleagues at Syracuse University collected participant data as part of the environmental Exposures and Child Health Outcome Study, which is an examination of cardiovascular risks and environmental toxins in children, specifically looking at metals, including lead, mercury, and cadmium. And the sampling was conducted in the city of Syracuse, with participants living both in and near the city area. There was targeted sampling in low socioeconomic neighborhoods, and the design was cross-sectional with around 60 new participants each year, sampled from 2012 to 2018. And the participants aged 9 to 12 and contributed a lot of different data for this project, including blood draws, urine samples, dietary habits, and cardiovascular data, providing a really robust and potentially complex examination of how these are related to each other. And so our contribution to this study was looking at the potential of the exposure pathway of air pollution and how that might be affecting the children's biomarkers that we were looking at. And so to estimate potential exposure to the specific metals that we had data on, we used the risk screening environmental indicators, or RISI data, and we were specifically working with the geographic microdata. So the RISI data are derived from the US EPA Toxics Release Inventory, which is a database of annually reported chemical release and management data from qualifying facilities. The RISI GM model takes release data from the TRI facilities and then uses fate and transport modeling to predict where the pollutants go once released, with current methods modeling transport up to 50 kilometers away. And so this model gives us estimated concentrations of individual chemicals across a grid system covering the entire US. And so we have resolution down to 810 square meters, grids providing a very fine grained resolution of air pollution estimates. And this data set goes back to 1989. And so what we did with this data was take the location of participant homes in the city of Syracuse who are part of this project and intersected them with the grid cell that the home was within. And we then took a cumulative estimate for each of the metals in the study by summing the early years of potential exposure each participant may have faced to create a spatial life course epidemiology. And so this definition from GIA is that spatial life course epidemiology is an emerging area of science that seeks to investigate the life course effects of environmental and other spatial factors on individual behaviors and health outcomes at high spatiotemporal resolution, accuracy, and precision. So the key here is this idea of high spatial temporal resolution, which is what the RISI data provides. And our contribution of applying the RISI data to the clinical data provided a source for estimating this sort of over time and space exposure to these pollutants. And so our cumulative metric of total early life exposure to each of these individual metals is one way we thought we could estimate the potential of this low level exposure, and then link to the specific biomarkers in the study. And so biomarkers are one way that we can measure exposure to different contaminants. The data we had included participant blood metal levels, which indicated exposure to specific toxins from some source. We had blood metal levels, as I said earlier, for lead, mercury, and cadmium. Today, I'm going to be focusing my presentation on the results for mercury and cadmium for the sake of time, but if there's any time at the end or questions, we can discuss lead. So why would we want to use biomarkers? Biomarkers are used in a lot of different studies and are excellent because they're considered objective and measurable indicators of some medical effect on the body. In the context of this study, the blood, and we also did have some urine data, biomarkers are quantifiable values which indicate exposure to specific toxins. In this case, the metals we're working with. And so oftentimes identifying the pathway by which the metals enter the body isn't quite as straightforward as well. The person may have been exposed to, mercury in the air. There are a lot of other methods and ways that these metals can be introduced to the body. And so these confounding factors include things like trace metals in diet and exposure to secondhand smoke. And we do consider both of these pathways in our models. So we use both linear and spatial models to test for associations between the RISI cumulative exposure metric we have and the blood metal levels. We started by fitting linear models to sort of understand the data. And for blood mercury and estimated air exposure for the first 5 years of each child's life, we did find a simple linear correlation with more exposure correlating with more blood mercury in our participants. But because we're working with spatial data, a linear model usually is not the best model. And we wanted to test for this possibility that a spatial model would be better, particularly for controlling for things like spatial correlation of our dependent variable. And so to do this, we used a Moran's eye test for spatial autocorrelation. And the test, is used to indicate whether or not our observations are clustered together in a non-random way. And when we look at the data, we see that blood mercury levels do appear to have spatial clustering, where we have higher values cluster with other nearby participants who also have higher values of blood mercury. And these observed blood mercury values appear to correlate fairly well visually and spatially with the distribution of the RISI grid values for the city of Syracuse, where we have higher RISI estimates. There appear to be higher blood mercury. Of course, the fit isn't quite perfect, and it's also really just a visual look. But this suggests that maybe a spatial model would be better and provide us more robust estimates of whether the two are correlated. And so the Moran's eye test did detect autocorrelation for the blood mercury model, not for some of the other models. So our next model, to sort of incorporate and remove the spatial correlation, we chose to use a spatial error model, which added a spatial weight to the model designed to remove the non-random error and make it more random. And so just a little more detail on this spatial model we selected. So we used a model called a simultaneous spatial autoregressive model. So this is a little bit of jargon, but hopefully will help understand these models a little bit better. And it's part of a family of models known as the spatial autoregressive models. And so the SSAR model we used is preferred in our situation because we use it when one object in space is expected to have similar values to other objects nearby. So in the case of blood mercury, participants' blood mercury levels were similar to their neighbors' levels. And so this model was better for fitting that kind of data structure. And so we took the spatial weight and added it to the error component of the model. And we chose to do this because while we did find autocorrelation for mercury, as I said, we didn't find autocorrelation for cadmium. However, because of spatial clustering of our observations, and I'll show you cadmium in a little bit, we suspected there to be autocorrelation even though we weren't detecting it. And so we chose the spatial error SSAR model to ensure our estimates were most robust. And so in case we weren't detecting something that might actually be there that our statistical methods may not be able to detect. So incorporating the spatial component to the model did carry over, and we did find correlation between air mercury and RISI between air mercury RISI concentrations and blood mercury levels. The correlation was positive and significant, even when including our covariates for other pathways, including diet. So the other main predictor you'll see in this figure is total protein in the diet is positively correlated with blood mercury detection in our participants. So we did not detect the autocorrelation for cadmium, as I said earlier, but we did suspect spatial cluster structure because when looking at the observations and mapping the data, we seem to have some potential clustering of our observations, particularly in the southwestern portion of the city. And they, similar to mercury, appear to follow the same pattern of RISI air concentrations of cadmium in the city. But starting with a linear correlation, the pattern, there was a slight linear correlation between the two, where where greater REC cadmium levels were correlated with greater blood cadmium levels. But one thing that we had to consider when working with this data was that blood cadmium as a biomarker, it's one metric, but it's not necessarily the best metric for chronic exposure. It's actually better for more recent exposure to cadmium, so within a few weeks to a few months. And so it wasn't the best matchup for the REC chronic exposure estimate we were working with. Urine cadmium is actually a better indicator of chronic exposure. And the reason we started with blood cadmium is because we had that data sooner, and so we only obtained the urine data more recently, in the past month, actually. So now we're able to actually look at urine cadmium and our chronic exposure rates. We have a better matchup going forward. But when looking at the blood and urine cadmium levels next to each other, just visually, there's some matchup, but there does appear to be greater variation potentially between the participant urine cadmium levels. And we see this with some of the higher values of urine cadmium and a greater range of values as well. But in our models, we did find, as I mentioned, there was this positive correlation between blood cadmium and REC cadmium, but the urine cadmium correlation was actually much stronger than the blood cadmium level. And these correlations were maintained with our covariates, including parental smoking status and diet. And so this is very encouraging to find that we have our better matchup of urine cadmium to chronic cadmium exposure had better results compared to the more recent metric of the blood cadmium. And so we were excited to find this. We still have a little bit more to do in understanding the pathways. But one thing that we are concluding and thinking and working with this data is that, potential chronic air pollution exposure in our participants is a pathway of potentially metal exposure amongst our participants. So some takeaways from this presentation that I want to highlight are that biomarkers of exposure can be linked to potential chronic low-level air metal exposure measured via regulatory data sources like the REC model, and that the REC-GM data are one way to estimate a spatial life force exposure to pollution. There are many more metals and chemicals to study in this data set in order to learn more about exposure pathways and to provide, hopefully, guidance to policymakers in understanding the uses of this data. And going forward, there needs to be more research to understand all the pathways of exposure. So we did include diet and smoking, but there are other routes of exposure out there that we either didn't have data on or have not taken the opportunity to look at yet. So that concludes my talk. I want to thank Johns Hopkins for hosting the events this week, and thank you to our funders listed here, and thank you all for attending. So that concludes my presentation.
Dustin, thank you very much. Also a very interesting presentation. So one question that I had, I guess, specifically about the SSAR models. So have you considered kriging instead as a potential alternative? And then also, do these account for just spatial dependence, or is there a way to account for both the temporal dependence if you do have temporal data in addition to it being spatial?
So the first part about the kriging, I have not considered that. We've talked a little bit about other methods, and kriging is one that is not one of my strengths. I don't have a lot of experience with. So the reason we went forward with this approach was because that was where most of my training had been. But other methods are definitely, I think, worth exploring, particularly because of just the nature of the data. We're still trying to understand all the variables that go into it in that. And then your second question about controlling for time, we didn't have to necessarily do that because there were, I mean, well, what we did to, I guess, to do that was our metric for exposure is lagged already. So like we take, you know, the location of the participant's home, and then we take the RECE data from, so if they're, you know, 8 years old and or 9 years old, right, and we took their blood in 2009, we use data from 2001 to 2005 for the RECE data to as their estimated exposure. So we kind of built in the temporal control a little bit there. Going forward, there's probably room for more complex models that might look at those things broken out rather than cumulatively. But as a first step, this is sort of the approach that we took.
Gotcha. Thank you. So thank you very much for all of our panelists. Now we have some time for Q&A. So if all the panelists could just turn on their audio and video, just so we can turn on the video as well. And so all the attendees, feel free to type in and ask questions. They can refer to any of the panelists. They can be more general as well. Dr. Collins, you've mentioned in the beginning of your talk this interdisciplinary nature of this work. What would you say are the directions things are moving? Is kind of, you know, the machine learning and big data, is that still very much like the driving force or a big driving force? Or are there other directions that are sort of being pursued and, you know, are driving this type of research forward?
Well, so yes, I mean, we're still very interested in, you know, formal informatics approaches using distributed computing or, you know, really trying to use AI or other, you know, more contemporary tactics. And so most of the effort to do that has been to set up these interdisciplinary collaborations where, you know, we have domain experts that might, you know, bring to the table a skill set that can be applied in a new way or in a way that helps us, you know, do some of the translation activities that we're interested in. So for example, there are two faculty members at Upstate Medical University who are part of our team, and they've been doing sort of high throughput analysis of biological samples, but they often don't have an environmental context associated with those samples. So a good example would be, we have a affiliated faculty member that studies Parkinson's and autism in the context of, you know, his clinical practice. And so one of our thoughts was, well, let's link up with people who are, you know, experts in machine learning or artificial intelligence approaches, and then also provide layers of spatial data about the lived experience of these people and try and you know, learn something about how these diseases emerge over one's life course. And, you know, so that's one example of things that are sort of in the pipeline, I would say. Maybe that's a little bit of an overstatement because, you know, these collaborations were set up and then the pandemic started and New York State fiscal situation became kind of challenging. So I think that what has been great about this project is working with people like Mike and Dustin, who, you know, are as talented as they are fun to be around. And that's how everybody, you know, that's part of how we've tried to set up the center, is to be, you know, get people who are really interested in collaboration as a core component, you know, rather than just their little, you know, expertise chunk that, you know, they might be, you know, like definitely amazing at, but trying to apply it in new ways.
And to sort of follow up on that, do you feel like there are any other fields that have not been, tapped yet as much that could really contribute to this, again, interdisciplinary nature?
Yeah, I mean, I think that we've had really natural collaborative relationships with public health department people, basically, like bioinformatics or epidemiology, or even molecular biology to some extent. One of the things that I think is really untapped is like the omics side of things, like the genomics folks and the people doing more genomic work that I think really would lend itself to linking with environmental exposure data that we might have more expertise in. And I don't know if I haven't, been at the right table or something like that to meet those folks. But I think that when you think about like a link between an environmental hazard and a health effect, you could couch that as really some sort of stressor on the body, right? And so that stressor can affect, genomic profiles. It can affect, disease outcomes, and so trying to study stress more holistically, I think, would be something that would be a real inroad. And at least one of the pet ideas I have is to try and really create a network of these amazing cohort studies, and that might not be about environmental exposure, right? But they've done such a good job collecting temporal and case controlled data that placing it in the context of environmental exposure might lead to sort of a holistic understanding of what neighborhood stress might be like, or something like that. But as I said, like that's somewhat of an overstatement, or it's a little farther off than maybe it would have been 6 months ago, just because there has been a lot of stress from, because we only have one word here to describe this, but stress from other angles, right? Like just because the pandemic and university response has been challenging.
Right. Mike, so it's very interesting and nice to hear about for the COVID project, right? You said that everything was placed on GitHub and it was kind of done using open source software. It's always exciting, I think, to have this part of research potentially being shared and used in other places. Is that part of the idea? Are you thinking of like expanding this to other locations, or allowing kind of other users to adapt the code, right? And then like to follow with my previous question, whether in other countries or just in more specific regions, and is that in any way, like, is that a big part of the project?
Yeah, I mean, I think it's an essential part of the project, because we've already, in working, I mean, part of our mission at the center is to make our science actionable, and by making all this code accessible, readable, and easy to follow, we've already made it accessible to numerous media news outlets who have been interested in working with regional parts of this study. So we had a piece come out in the city based on diesel particulate matter and COVID-19 in the New York City 5 boroughs. At more regional work. Sorry, I don't know how much of that you caught, but yeah, it's been essential for enabling those partnerships with groups inside and outside of academia. And we just, I mean, and going back to what Mary was saying, we think what's astonishing to me is I was born in 1990, and I can now, by living in the United States, based on our policies, I can track my exposure to the day that I was born to certain environmental contaminants. And this depending, we can build a system where you can say where you lived, where you worked, and down to a 800-meter grid, we can tell you what chemicals you may have been breathing in at that time. And this is just such a valuable research in social justice work, in environmental epidemiology, and just public awareness. So making all of these research methods accessible is going, because it's not just going to be us that needs to work on this. So bringing more people in is going to be essential.
And then also about, so like with the Enviro screen, wasn't sure how to pronounce it, but so that project, right, it's focusing on New York State, which includes both New York City, of course, and then the rest of the state. So there's this very, very wide difference in terms of density, like, you know, perhaps more so than in most other places in the country. Is that the fact that it's included into a single model? So I understand that, you know, you allow for, you control with covariates, but is that a concern, or like, has there been thoughts about looking at those separately because they're just such different environments, like rural New York State versus Manhattan?
Yeah, I mean, that's what is particularly challenging in New York as compared to other states. And yeah, we have this huge divide. And that's why, so when we created that system based on Enviro screen, we saw that none of rural New York would have been classified as a disadvantaged community at all. And the system would only cover about 1% of the entire land mass of New York State. And what we've seen is we've seen a lot of wind development in New York, wind power. And there's been instances where communities haven't been able to participate in the process as robustly as would be desired. And in part is because they were not, these areas that were linguistically isolated because of Amish country, or they're impoverished. They weren't classified because or in the system, they wouldn't be classified because New York City dominates a lot of these environmental exposure factors. So that's why we included those second and third steps in the decision tree, so that some areas, especially the tribal areas and areas that had high rural poverty, because rural poverty has been expanding in New York, would be covered under this system. So it was a unique challenge, and hopefully with making all this code accessible, it's not a challenge that is only experienced by New York. There's a lot of states that have very divided rural and urban areas. So potentially this could be used elsewhere, and the code is all there. Yeah,
no, it's certainly one of the wonderful things about R and open source software in general. Dustin, I was curious if you could elaborate a bit. So you mentioned this, spatial life course epidemiology is this developing field, and so the way I see it is kind of a spatiotemporal analysis setup. Is that sort of the technically wise? Is that the main sort of challenge to account for both space and time, or are there other aspects to it that I guess maybe I missed?
I think that's a good summary, space and time, but I think there's a lot of other, like space and time themselves are complex enough that you could, that could be sufficient, but there's a lot of other things. The other thing that the definition that I didn't talk a lot about was behavior. So like we can observe where people have been, like Mike referred to, like he could do an epidemiological look at his life and the air plumes he's been exposed to over time and account for his movement. But there's also things like behavior that that is a separate thing that's unique to, not unique, but like when looking at humans, you know, you would bring in the choices that they make. So we bring in things like diet, exercise is something that's varies from person to person. So these sort of conditional factors that are, you can collect data on it if you have that at the outset. So those things have to be, I think, considered just as much. And there's a lot of other things as well. And spatial life course epidemiology, it's emergent. I'm and our group are, really getting into like the beginnings of that, I think, as a group, and we're still exploring different ways to understand that as well. So beyond those factors, there's a lot, I think, to include.
Gotcha. All right. So I'm not seeing many other questions. So thank you very much, panelists. I think this has been very, very interesting. Let me share my slides. One moment. There we go. So yes, thank you very much for your time. These have been great talks. Thank you for all the attendees. So again, we mentioned that the recordings will be made available for all of our sessions, or all the ones that agreed to recording. It'll be put on our landing page. So we have 4 more sessions left in our GIS week. We have 2 tomorrow and then 2 on Thursday. If you're interested, certainly encourage you to check those out as well. There should be lots of interesting stuff. So the registration links for those will be put in the chat. I think they might be put in the chat as I speak. Again, thank you to our co-sponsors, the Center for a Livable Future and the Spatial Science for Public Health Center. If you're interested in learning about either of these great centers, then we're going to provide links to those as well, just so you can check them out. All right. Thank you very much, everyone, and enjoy the rest of your day.